Nothing is more important to us than the safety of our patients and staff. We have been consistently making improvements and upgrading ourselves in line with government protocols to make General Hospital Satpally fully prepared to deal with the threats posed by coronavirus. Rest assured, we are taking it very seriously, so we have prepared this short film to remind each one of us to keep doing what we have been doing every day, because combined efforts are critical to collective success. Let's spread awareness and not fear for coronavirus. Upon arrival, the entry gate to the hospital has to be restricted in order to reduce crowding in the OPD and inpatient areas. Social distancing will be enforced by making visitors stand in queues within stipulated areas marked on the ground. Thermal scanners will be used to check the temperature of all patients at the entrance. Those found to have a temperature of 38 degrees Celsius or above will be directed to a designated area and referred to the concerned operations personnel. Patients will be allowed inside the hospital only if they are wearing a mask. Those not wearing masks will be provided with one at the entrance. All patients entering the hospital shall use hand sanitizers. Triage and questionnaire-based screening procedures will be done at the registration counter. Those with respiratory symptoms will be directed to a designated area near the blood bank where they will be assessed and managed as per guidelines. Physical barriers such as glass or plastic windows will be used to reduce exposure to coronavirus. This approach will be implemented in areas where patients will first present, such as triage areas, the registration desk, emergency department, and at the pharmacy window where medications are collected. Staff at the registration counter will wear appropriate personal protective equipment or PPE and talk to the patient at a distance of 1 meter. Social distancing will be ensured by keeping people at a distance of at least 1 meter apart at the OPD queues, in waiting rooms, and corridors. All patients entering the OPD zone shall use hand sanitizers before entry and at exit. The number of patients entering the doctor's chamber will be restricted to 1, with exceptions like disabled patients or children. Doors in the clinic rooms will be kept open to avoid handling of doorknobs and to maintain ventilation. Standard precautions will be used by all healthcare workers taking care of patients. They include the use of appropriate personal protective equipment or PPE, hand and respiratory hygiene, and adherence to protocols of sanitization. All staff will be trained in the correct steps and techniques to wear and remove PPEs. Appropriate PPEs will be used based on the risk of exposure, which would vary according to the personnel and type of activity. Good hand hygiene will be aggressively promoted. Frequent hand washing and use of sanitizers, refraining from touching the nose, eyes, or mouth, avoiding handshakes, instead, greet with a wave or namaste. After performing hand hygiene with an alcohol-based hand rub, secure the mask, either with ties at the middle of the head and neck or with elastic ear loops around the ears. Then, fit the flexible band to the bridge of the nose, making sure it fits snugly to the face and below the chin. While in use, avoid touching the mask. Remove the mask by using appropriate technique. Do not touch the front of the mask. If there are ties, remove the ties from behind. First the lower, then the upper one. After removal, clean hands by using an alcohol-based hand rub or with soap and water if the mask is visibly soiled. General cleaning of floors will be done in every shift. Furniture will be cleaned daily. All high-touch areas like doorknobs, handles, air and light controls, keyboards, switches, etc. will be cleaned 4-hourly. In the OPD, deep cleaning will be done twice daily. The consultant's table and patient examination table will be cleaned every 2 hours. Patient care equipment will be cleaned as per infection control guidelines. Other equipment like ventilators, monitors, defibrillators, and diagnostic equipment will be cleaned after every use. Vehicles used for transporting patients and staff will be sanitized both on the interior and exterior, as the coronavirus can stay on plastic for 3 days and on metal surfaces for as long as 5 days. At the cafeteria, social distancing will be implemented by making staff stand in queues in squares marked on the floor. Meal times will be staggered to avoid crowding. Official meetings will be held following all precautions to stem the spread of coronavirus by practicing social distancing and encouraging use of masks. Meetings will also be held in the open to avoid closed spaces. Assigning key roles and responsibilities to different personnel and healthcare workers is also a part of the strategy to deal with the pandemic. Regular training modules will be conducted for frontline staff and healthcare workers in proper use of PPEs and strict personal hygiene practices. Cover your mouth and nose with a tissue paper when sneezing or coughing. If you can't find a tissue at the time, use your arm in a way to cover your mouth and nose when sneezing or coughing. Avoid unnecessary touching of common surfaces such as door handles, staircase railings, or walls in any public place or your workplace. No definitive treatment or vaccine is available for COVID-19. No one can predict when this coronavirus disease will disappear, but if we take all possible precautions, we can keep corona away. For detailed information regarding precautionary measures, keep referring to the standard operating procedures. The trajectory is in our hands. We should all contribute to stop this pandemic by spreading awareness about the coronavirus. This way, we can take care of everybody who needs to be taken care of. Stay safe, stay healthy.